am Emily Denney. I'm a pediatrician originally from Carrollton, Georgia, coming back straight out of residency to practice at Teener Healthcare for Children in Bremen, Carrollton, and on the inpatient setting, and occasionally the Teener Care for Kids and some spots are open there. We get a question a lot throughout your training as you're going through your interviews, or even from parents sometimes, or the patients that you're caring for, why pediatrics. For me, it was a pretty easy decision. I was raised around the pediatric community. My mom was a pediatric nurse. She worked at the clinic that was across from the hospital when I was growing up. So I was in that back room a lot, or sitting in the lab, watching that interaction that those pediatricians had with their patients. I knew that was something that I wanted to have, where I get to have fun, I get to play around with the kids that I see in clinic, and then I get to go and do it with the next kid. And each kid that I see, as I develop a patient population, I get to watch those kids grow. They get to grow with me as I grow as a physician. I get to see a kid for their first newborn visit, for their weight checks, get to see them for the first couple of months of their life. I ask them as they grow, what do you want to be when you grow up? And they go from saying Moana or Spider-Man to maybe a teacher or a healthcare worker. I get to talk them through difficulties around puberty, changes with their bodies, other emotional changes that come with just being a kid in today's world. And then most of all, I get to see them as they grow up and go out into the world, decide what they want to be. I am a mom myself. I have 2 children. I had them when I was in residency. And despite being a physician, technically out of medical school, when I had my daughter, I didn't know that kids do such weird things. They make weird voices, they make weird movements, and they do weird things. So a lot of times we have parents bring questions to our attention. Hey, I just wanted to run this one by you. Is it okay if my kid does X, Y, and Z? As a pediatrician, I love those kind of visits. I love getting those my chart messages of, this is what I'm seeing in my kid, should I be concerned? So I try to tell all parents, anytime you have a question, shoot us a message on my chart, give us a phone call. The nurses that answer the nurse triage line know that they can always send any question straight to me, and I have no problem answering that, however crazy it might seem to parents, because each kid is different. Maybe this time it is normal what they're doing, maybe the next time they're doing something it's not normal, and that means that I get to play detective and try to figure out exactly what's going on with your kid. So my advice to all parents, any question that you have, run it by your friendly local pediatrician. Ask them, is it okay? And if not, what should we be doing about it?